I'm a family doctor, and I need to give you a piece of advice that might just help your health, might even save your life. And I'm saying this because honestly, I've seen a few cases of this in the office where this has happened. I'm going to tell you in a moment, where people have not heeded this advice and it had dire consequences. This is really, really important. If you go to the hospital or the emergency room for almost any reason, whether it's chest pains or shortness of breath or whatever is going on, I need you to make sure that you are following up with your primary care provider after you get out of the hospital. Now, you might be saying, well, Dr. Jen, why would I do that when the ER or the hospital fixed my issue? And by the way, that's what we hope will happen. We hope you come out of the hospital or ER with your issue fixed. That's not the problem. It's when you go to the hospital or ER, you're likely having tests done. Chest x-ray, EKG, lab work, maybe an abdominal CAT scan, maybe you have neck imaging, whatever the case may be. And oftentimes, I can tell you this because 17 years of experience has taught me this happens all the time. Oftentimes, we find what are called incidental findings. Okay, on that abdominal imaging, you might have an adrenal adenoma, or there might be a renal cyst, or there might be something else. You might find a thyroid nodule in neck imaging, or maybe there's a lung nodule on lung imaging. Or maybe you go to the hospital and we find out that you have a low blood count or anemia when it wasn't that way before. The thing about it is the hospital, the ER, and God bless those folks, they do an amazing job, but they're going to focus on the things that are of utmost importance to your health at that moment. All the other stuff needs to be dealt with as an outpatient. And the bottom line is, if you don't come back to your outpatient doctor, your PCP, to go through those records and to find anything that could have been found incidentally and follow up with them, those things may never get followed up on. I have seen patients go to the hospital, never follow up in the office, and end up with metastatic cancer because abnormal findings were not followed up on. This is not to scare you. It's just to say, if you go to the ER or the hospital, make sure you follow up with your PCP to go through the records and to make sure there's nothing else that needs to be done. That thyroid nodule, lung nodule, the labs, etc. It's literally, for some people, can be the difference between life or death. So please, 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 make sure you do this. Share this with your family and friends too.